Disorder Treatment Month, shining a spotlight on treatment, recovery, and the barriers that still keep people from getting help. South Carolina leaders say that stigma remains one of the biggest obstacles. So joining us now, we have Sarah Goldsby, the Director of the Office of Substance Use Services, to help break it all down for us. Sarah, we appreciate you coming by.
Thanks for having me.
What does recovery and treatment look like today here in South Carolina?
Yeah, so, there are many options available, and I think that's one of the main messages, is that there are many paths to recovery. And what we know is that millions of Americans who have substance use disorders and need treatment, they don't get the treatment that they need. And so it's really about raising awareness of the many options for both clinical care and social supports.
Yeah, I mean, there's also a common misconception of it's not a one-size-fits-all when it comes to stuff like this. And you kind of mentioned there's a bunch of options. So what is available right now?
Yeah, so we've got a lot of private and public providers across the state that are offering the many levels of care that people might need depending on their very unique diagnosis. And I think that's a primary point, is that treatment needs to be tailored for the individual and the diagnosis that they have. And there are different levels of care for that, all the way from inpatient hospital care to outpatient, clinical care that can be daily, weekly touch points, both for medications or counseling.
It's also important, this does not just affect one person, does not affect one group of people. What are you seeing here in your office?
Substance use disorders really impact families. They impact communities. They impact, friend relationships. And I think that's another important point. And what we're trying to raise in awareness this month is that family, loved ones, church communities, friend groups, they all play a really critical role in people's path to wellness. People feel a lot of shame. They feel a fear and a shame about their alcohol and drug use. And so the best thing that people can do is be judgment-free. Allow folks to feel comfortable knowing that this is a disorder, a chronic disorder, a treatable and sometimes deadly disease that deserves health care just like any other disease. If we can approach this without judgment but with support, that allows people to feel comfortable to get what they need.
My last question to you, somebody's watching right now, somebody's going through this, they know somebody. Talk about the resources. They don't do it alone.
Yeah, so, educate yourself on the many levels of care, different types of substance use disorders and different kinds of treatments. Many treatments need medication. Opioid use disorder specifically needs medication, and that should be without judgment. And then, find out what options are available. We have a national helpline, 1-800-662-HELP. There you can learn all about the different options that are available, but the key is individualized care. Get in to get an assessment, right? And then start your journey on the right level of care for you.
Start that right now, because there is no shaming in getting help. Sarah, thank you so much for being here. We appreciate you.
Appreciate the opportunity.
Of course, and we're going to be putting this on our website, WLTX.com. You do not do this alone. There are so many resources and, of course, family and support that's here to help.